Diagnosing Alzheimer's disease. Although Alzheimer's disease is a progressive disease, its development is slow, so there is a risk that it may be confused with memory issues as we get older. Just to be clear, Alzheimer's disease is not a normal aspect of aging. Future Genetics has prepared this disease information module because there is a need for the public to be aware about Alzheimer's disease, and particularly its symptoms, coupled with the importance of consulting your doctor for advice and a proper diagnosis. Sometimes somebody with Alzheimer's disease may not realise that there are issues with their memory or recall. It is therefore important that if you, as a family member or a friend, notice changes in a person's memory, please seek help from a healthcare professional such as a GP. When the person goes to see the GP for a diagnosis, it's useful if somebody who is a family member or friend also attends. Just because a person has issues with their memory, it does not necessarily mean that they have Alzheimer's disease. This is because there are many different factors and conditions that also result in issues with memory. However, given the seriousness of Alzheimer's disease, go for a diagnosis, even if it is to potentially rule out the disease. Even if the diagnosis is positive, then this can still help the person. Diagnosis, and in particular early diagnosis, are imperative, as it can allow for help and support to be given to a person that may have Alzheimer's disease. If the diagnosis has been made at the earliest stages of the disease, then currently available treatments can be reasonably effective in delaying the progression. It also allows and empowers the affected person to make their own decisions for planning for the future. There is no single definitive test that a doctor can carry out to diagnose Alzheimer's disease. The doctor will ask questions that relate to both Alzheimer's disease and other conditions. If other conditions without Alzheimer's is suspected, people would ordinarily refer the person to a specialist. The specialist will look at 3 key things. 1. Carry out a comprehensive review of your symptoms. 2. Perform additional tests that will include scans of the brain. And 3. Discuss and agree a treatment and care plan.